So we have a 54-year-old gardener with diabetes mellitus who acquired a small scratch from a thorn while working in his flower garden. After 3 weeks, he noticed a small pink painless bump at the site of the scratch. Additionally, linearly distributed bumps that resembled boils began to appear a week later and were quite painful. When the lesions took on the appearance of open sores that drained clear fluid, as shown in the image, he finally visited his physician. Skin biopsy results are pending. Which of the following is the most likely diagnosis? All right, so we have the options. A is paracoccidiomycosis, B is blastomycosis, C is cat scratch disease, D is leishmaniasis, and E is porotrichiosis. What I usually do in a question is I first go through the last line. So the last line tells us nothing much. It just tells us when the lesions took an appearance of open pores, they drained out clear fluid, he was finally visited the physician, and also it's just asking for the diagnosis. All right. So when we come to the beginning of the question, we have a 54-year-old gardener with diabetes. So diabetes increases the risk of sporotrichosis. All right. And now they give a typical history of a small scratch from a thorn while working in a flower garden. So they again give us a typical case history that he was in the garden and he had a scratch from a flower thorn or something. So it's usually present on the plants, the spores of sporotrichosis. Okay. And now he has a small painless pink bump, which was followed by linearly distributed bumps that resembled boils. So the thing is, sporotrichosis is the fungi which has a lymphatic spread, like it spreads in the order of the lymphatic. So if you have a sore over here, it will go around this entire arm to spread throughout the entire lymphatic system of your arm. All right, and that's why you will have multiple linearly distributed bumps. All right, and to rule out some of the options, so you could easily rule out paracoccidiomycosis and blastomycosis because they usually always have lung involvement. Blastomycosis is has lung involvement with skin involvement, but if a question like you'll come across this in UWorld too, that if a question is talking about blastomycosis, they will usually refer to it as purple gray varicose lesions or something like that, right? So if it's a sporotrichiosis question, it will be a specific description as mentioned in this question, like linearly distributed bumps or something, okay? And they're all painful. All right, and then we come to leishmaniasis. To rule out leishmaniasis, just remember it's usually a single sore or which turns into an ulcer with a central clearing. All right, not at all presenting like that. All right, and few things which I want to discuss about this is, and I'll ask you. So it's a dimorphic fungi, right? So that means it presents in two forms. So always remember this point you will come across in your UWorld too, that in a biopsy finding of a sporotrichosis lesion, you will probably see cigar-shaped budding yeast. Okay, and also remember one thing: the sporotrichosis present as granulomas. Basically, these are granulomas inside the lesions. Okay, which you when you biopsy them, you will see cigar-shaped budding yeast. All right, and in warm, maybe like 25-degree or in a culture, you will see branching hyphae with rosettes. All right, so it presents as both yeast and molds. So the yeast can be seen in the biopsy, budding yeast, and the branching hyphae, which are the molds, will be seen in cultures at 25 degrees C. All right. And coming to the treatment, it's usually itraconazole. Also, first aid mentions potassium iodide too, right? Although it's an obscure fact, but still I think you should know it since it's mentioned in first aid. So itraconazole and potassium iodide. And also one more thing you have to remember that in diabetics, alcoholics, and in COPD patients or any immunocompromised state, the risk of having sporotrichosis increases.
Thanks for watching. Please give a thumbs up and subscribe for more.